But Dr. Yovan, coming to this now, let's talk about hygiene. Now, let us say we have a patient with neuropathy. अब 20 साल से शुगर है, एल्डरली हैं, नर्व्स अब उतनी जवान तो नहीं है जितनी 18 साल पे थी. डॉक्टर योवन की तो जवान रहती हैं वैसे. This much Hindi, doctor. Yeah, देखो smile देखो. Dr. Yovan understands all the nice parts of Hindi. Yeah. So the nerves might become weak, maybe because of age, maybe because of diabetes, and maybe because of vitamin deficiency. Right? So how can we maintain foot hygiene? What are the important things to do? What can we do at home? In the meantime, Vivek Mugdal and Anisha Vincent Poonam Groverji all saying namaste to you.
Hi everyone. Maybe one thing that I would like also on neuropathy is structural deformity, hamartomas. So these are further down the line where you have got already structural deformities, because it's not only the sensory part of neuropathy, it's the motor part, and motor part actually is an imbalance between the flexor and the extensor muscles, as you all know, which causes deformity and which changes the whole structure of the foot. Maybe we'll have the opportunity to talk more about the Charcot's disease, which is one of the most eminent forms of neuropathy, I would say. And yeah, just coming back to your questions. So yeah, I would think hygiene is the basic. I always tell my patients when I talk about foot in the foot clinic that we have here, is look at your feet. Have a look. If you can't see it, get your feet in front of a mirror. We have kind of a telescopic, I don't know if you have that, in a telescopic mirror where you've got kind of a rod with a small mirror at the end of it, and then you can just pull it and then look at your feet with just hand holding it like this, actually. So you can see the sole of your feet, because sometimes you can't just lower yourselves or get your feet high up to see the soles, or you have to ask someone to see whether the sole is okay. So hygiene is of prime importance. We'll have the opportunity to talk about fungal infection, onychomycosis, and these are known to be favoring causes of ulcers and starting points of infections. The fungal infections themselves often start from poor hygiene. Ulcers starting from bruises also often start from people who walk bare feet. Who, when you look sometimes at the, I was thinking about the foot care nurses that we have in Mauritius, and when they look at the dressing, and when they look at the patient and tell them you've been walking bare feet, because when you look at this, at the way that the dressing is dirty, and you see that this patient has been walking bare feet at home, there's no other way. So even when people have got a dressing on their feet, they still sometimes, unfortunately, fail to maintain good hygiene. And it is our duty to help to talk about basics in terms of washing feet, in terms of finding using clean socks, in terms of using clean shoes, in terms of I would say looking at your feet, whether there are any things that could, any dirt on the feet that could favor different infections. So hygiene is key. I agree with you on that.
So Dr. Yovan क्या कह रहे हैं कि hygiene या सफाई, this is the key to foot care. ये सबसे important चीज है पैरों की देखभाल की. डॉक्टर साहब बार बार हमें कह रहे हैं आप अपने पैर देखें, रोज देखें. अगर आप नहीं देख सकते तो शीशे का इस्तेमाल करें. Use a mirror. If you can't use a normal mirror, use a telescopic mirror. इसकी लंबी सी डंडी होगी ऐसे, और आप अपने पैर का निचला हिस्सा भी देख सकते हैं. So ये बार बार मैसेज आ रहा है, रोज अपने पैर देखें. अगर आप खुद नहीं देख सकते, किसी और को दिखाएं. So that was message number 1. दूसरा था, इनको साफ रखें, रोज साफ रखें.